cheese might not be the first food you'd associate with heart health, especially if you're still clinging to the outdated belief that anything creamy and flavorful must be a cardiovascular villain. But science is now revealing a much more nuanced and, frankly, more delicious picture. Beyond its calcium and protein profile, cheese contains something far more sophisticated. Functional bioactive compounds that do more than just feed you, they may actively protect you. One standout in this field is the group of antihypertensive peptides released from casein, cheese's main protein, during digestion. Yes, that smooth wedge of Gouda might be doing silent battle against high blood pressure right under your nose. When we talk about casein, we're talking about the major protein found in milk and, by extension, most cheeses. But casein isn't just a structural protein, it's a kind of sleeper agent. During digestion, or even earlier, through cheese fermentation, enzymes break it down into smaller fragments known as bioactive peptides. Some of these peptides act in a way that's strikingly similar to prescription blood pressure medications. They inhibit angiotensin-converting enzyme, or ACE, the enzyme responsible for constricting blood vessels. When ACE is blocked, blood vessels relax, allowing blood to flow more easily and reducing overall pressure. This is the very mechanism targeted by a common class of antihypertensive drugs, which makes it all the more fascinating that your cheese plate could be doing something pharmacologically relevant. This effect isn't just theoretical. Studies on fermented dairy products, especially aged cheeses like Gouda, Edam, and Swiss, have shown promising reductions in blood pressure among people with mild hypertension. These cheeses naturally contain peptides such as valproPro, VPP, and alpropro, IPP, both of which have been shown to help reduce systolic and diastolic blood pressure in clinical trials. While they may not be a standalone substitute for medication in severe cases, they offer a food-based option that can complement existing treatment or help prevent hypertension from developing in the first place. The beauty of these peptides lies in their origin: fermentation. During the cheese aging process, beneficial bacteria break down milk proteins into smaller peptides even before you take your first bite. This means aged cheeses are not only easier to digest, often lower in lactose, but are also preloaded with compounds that may benefit vascular health. It's a mouthful of taste with a side of vasodilation. Of course, moderation is still key, especially since some cheeses can be high in sodium, which has the opposite effect on blood pressure. But that's exactly where the nuance comes in. Choosing naturally aged, lower sodium cheeses or consuming modest portions within a balanced diet allows you to reap the cardiovascular perks without tipping the salt scale. Pairing cheese with potassium-rich foods like leafy greens, tomatoes, or fruit can further counterbalance sodium's effects and amplify the blood pressure-lowering synergy. So the next time someone insists that cheese is a guilty pleasure with no health upside, you can confidently respond, actually, it's functional. Not just in the comfort food sense, but in the true clinical, bioactive, blood pressure-lowering sense. With casein-derived peptides quietly doing their work behind the scenes, cheese proves itself not just as a culinary masterpiece, but as a scientific one too.